Starting about 6 or 7 years ago, my wife had different kinds of physical impairments, bad shoulders, bad legs, and so forth. But suddenly, out of the past came something much more different and difficult. She was determined to have a brain cancer in her tumor in her head. So that resulted in her going to a skilled nursing facility. After she had been there for some 3 or 4 months, the medical director of the facility called and said, "It's time to bring in hospice." And I didn't know hospice from the East Bay from anything else except it was a name. But that call came at night, and early in the morning when I was over there again in the facility, in comes the nurse from hospice of the East Bay. And she introduces herself, tells us what she's going to do, sets up a program and says, "The first thing we do, Mr. Origlia, is you leave the room. And we'll talk with the patient. And when we finish with the patient, we'll talk with you and tell you what our plan is." And by gosh, that's exactly what they did. They cared with honesty, intensity, and regularly evaluated what you needed to have done, what they were going to do, and what the likelihoods of the outcomes would be. So that was a good start, and they were helpful to her, and obviously a great help to me. But as time went on, my wife's condition continued to diminish, and we were all getting prepared for that. And even though my wife was still alive, hospice had the wisdom to call me aside one day and sit and chat for a moment and say, "We think it's about time that you have a little bereavement counseling." And I said, "My gosh, we don't have a bereavement condition here. My wife is still alive." And they said, "No, this takes time and it takes preparation and understanding." I said, "Well, everything that you've done so far is absolutely outstanding. I personally never had any belief in that kind of counseling. If you say it's good, I'll take it." And I did. And were they right? I had the privilege and the difficulty of holding my wife in my arms when she passed. The best part about it all is that it made my wife comfortable. It gave her a feeling of security, and it enabled her to have a pain-free exit from this world, and that was one of her great gold hopes. I was lucky, my wife was lucky, and we were very proud to have hospice of the East Bay.
We had this wonderful, very special gentleman came to the Bruns house, which is our inpatient facility in Alamo, and he didn't have family at all, in fact. And he had just one friend, as I recall, that did visit him in his time at Bruns. I didn't inquire, but I think from looking at his shoes and his clothes, I didn't think he was a very wealthy man. I don't think he got out very much. And pretty soon after he got to Bruns, he fell into an actively dying situation. And then we called the vigil. A vigil was called by our volunteer department. And it was just the ideal case of having someone that really did need this sort of a vigil. It was just perfect. And over 2 weeks, there were many of us that were there, but we'd brush his beard or put lip balm on him. And he really liked the lip balm. He really liked having his beard brushed or combed and his hair combed. And he loved having his hand held. And he just really responded so very well to it that he kept living. He was enjoying his vigil, I think is the best way to put it. And we call it a super vigil because it actually went 2 weeks, which was amazing for a man who wasn't eating or drinking this entire time. I think he really felt loved, which we did love him. I think he got a lot of love and a lot of care, and I think those might have been, I really felt at the time they might have been the happiest days of maybe in his memory, even though he was dying. It was really a beautiful vigil and a beautiful thing.
I was was managing one of our shops in Danville, and a lady had brought in her husband's things. He had passed away 4 years before that, and she has waited all this time to go through his things and lovingly washes them and carefully folds them, brings them to the back door. And as she's dropping them off, it's very difficult for her. And she gets to the last bag and she picks up one of his shirts and she smells it and she starts to cry, and I start to cry, and somebody else from the back room comes out and we're hugging her and telling her that we have bereavement services. And for her, she has not, at that point, was not seeking any outside help. She thought that she had her family, and I think had put a lot of things on hold, and it was at that point realized that she was still grieving very strongly, and we referred her to bereavement, and I'm sure she went, and I know they were able to help her. And yeah, that was just part of, we get that a lot. We get a lot of people coming in who whether it's 4 years or recently, lost somebody very important to them, and going through their things is very painful, and our staff is very sensitive to that, and we want to be there for them, even if it's to give hugs at the back door. We give the comfort and the care and the support that people need, that families, that patients need, that we have a level of love and support that I think sets us apart from the rest.
The nurses and the doctors at the hospital asked us how my husband would like to have his end of life be, and in the hospital or hospice, and hospice meaning at home, and so my husband said at home. So the social worker and doctor both said when we got home to call. Within a day or two, a very nice lady came out to take my husband's history, and then about 2 days later, another lovely lady called, and that was my husband's hospice nurse. You have to understand, all this happened within a week, and I had no idea what hospice was about, and I just greeted everybody at the door and went with it, and they were all lovely and nice, and in finally meeting Gene's nurse, she would be the one that would care for him on a weekly basis. I have 3 adult sons and a lovely daughter-in-law. They were able to enjoy my husband because hospice gave us the tools to show us the way. It was towards the end that it affected my sons mostly because they saw their father decline, but not decline in a bad way, decline in a peaceful way, in really a gentle and loving way. And I compliment our nurse, and every single time I called the hospice office to ask a question, they were wonderful for me. Hospice has a bereavement side to it, and they called many times, maybe once every other week for the first 6 weeks or so, and then they gave me breathing space as to once a month to check in on how I was doing and my children were doing. End of life, death at home is wonderful. It's peaceful, it's lovely. If you can say all those things about death, it is peaceful and lovely, and it wouldn't have been that way for my husband if not for hospice.
This remarkable organization has helped thousands of men, women, and children get through one of humanity's most emotionally challenging transitions from life to death. For those leaving this earth, hospice staff and volunteers have provided comfort, companionship, and the assurance that they are loved. For those left behind, those same caregivers have provided solace and knowledgeable guidance towards emotional healing. And year after year, this constellation of care is made possible by the stars we are honoring tonight. Our dedicated medical specialists, social workers, vigil volunteers, grief counselors, thrift shop staff, and to those stars who, by shining their light of generosity down upon us, have made it all possible, our donors and supporters, to each of you, we say thank you. We ask your help to keep our constellation of care shining for many decades to come.